Welcome to Beyond Bitewings, the business side of dentistry, brought to you by Edwards & Associates PC. Join us as we discuss how to build your dental practice, optimize your income, and plan for your future. This podcast is distributed with the understanding that Edwards & Associates PC is not rendering legal, accounting, or professional advice. Listeners should consult with their business advisors before acting on any of the information that is shared. At Edwards & Associates PC, our business is the business of dentistry. For help or more information, visit our website at enassociates.com. Hello and welcome to another episode of Beyond Bitewings. In today's episode, we have a very special guest. Her name is Jennifer Page. She's with Carr, and she will be talking to our listeners about the amazing world of transitions, practice purchases, sales. So without further ado, Jennifer, how are you?
Hi, I'm great. How are you doing? Thanks for having me.
Oh, I'm doing well. Thank you. Absolutely. The pleasure is all mine. So, Jennifer, tell us a little bit about yourself and what Carr does, and how do you think our listeners can benefit from this episode?
Absolutely. Yeah, so Carr is a commercial real estate firm. We're based out of Denver, Colorado. We have about 135 agents all across the U.S. and in most major markets. And there's really two things that make us unique. The first one is that we are strictly healthcare agents. So we have all kinds of training and ongoing additional training on how to best represent healthcare professionals. And then secondly, and probably more important than the healthcare niche, is that we are what's called buyer tenant agents. And so basically what that means is that we only represent healthcare professionals in the real estate transaction. So what does that mean? We never represent landlords. We never represent sellers. That's super important if you're looking to relocate a practice, open a de novo office, because you want to make sure that you see everything in your market that's a good fit for you and make sure there's no conflict of interest with the agent that you're working with.
Bingo, right there. The conflict of interest. And this is one of those things that's very important to be on the lookout for, especially when you're looking for someone that's going to help you with the transition. Because otherwise, like I said, you may lose out.
Yeah, so what we see, unfortunately, a lot of healthcare practitioners do is they just kind of go out on their own and they may drive the market or kind of Google online looking for spaces. And if they see something that's interesting to them, they'll just call the agent whose name is on the sign in the window or the parking lot or maybe on the website. And that's your first biggest mistake, because when you call that agent, you're calling the person that represents the landlord, and they have a fiduciary responsibility to get that landlord the most money they possibly can in that transaction. I often tell people it's kind of like going into a courtroom as a defendant and hoping that the prosecuting attorney will also represent you. So like they have the skill set, right?
Mm-hmm.
But is that really in your best interest? Probably not.
Right. I see. Now, it's funny you mentioned that because, if I were in their shoes and if I didn't have this knowledge, I probably would have done the same thing. Yeah. Google that or, call the person that I see on a billboard. I mean, that's marketing for them working, right? But you're saying that, to get started, let's say if you've made that decision, how should they, begin the process?
Yeah, so I mean, the first thing they need to do is engage a real estate agent that will work on their behalf. Mm-hmm. And, there are lots of agents out there that they can partner with, but I think what you really want to focus on is one, somebody that really knows your industry. It's very different representing, let's say, like a nail salon or a restaurant or something like that versus a healthcare office. The concessions that landlords will give to healthcare tenants are very different than other uses. And so having an agent that really understands your value is super important. So one, somebody that knows your industry, and then two, finding somebody that won't work both sides of the table. So in other words, finding an agent that doesn't take listings, because, inherently there's going to be that conflict of interest. It's kind of like, If you have an agent and they represent a landlord that can give them, hundreds of listings to work on versus one dentist or one orthodontist, right, that needs a space, there's going to be pressure there to want to please the landlord that can give them repeat business over the individual that transacts and then is gone.
Right. That's a good point. Yeah, absolutely. I see. Now, in your field, you've been doing this for a while. What are some of the common mistakes that you've seen people make?
Well, outside of what we've already talked about, I
Hmm.
think not giving themselves enough time in a
Mm,
transaction. So let's say, for example, you're in a lease space and your renewal is coming up. We've seen a lot of people wait until, 30, 60 days out from their renewal to start thinking about, oh, well, what should we do here? Right?
hmm.
Well, you don't have time to do anything different if you
Hmm.
wait that long. So one of the things that we like to do is to track our clients' renewal dates so that we can engage with them a year, maybe a year and a half prior
Hmm.
to the expiration and say, okay, Doc, what are we wanting to do here? Are you wanting to stay here or are you wanting to relocate? Well, if they want to relocate, it's obvious what we need to do, right? We've got to go find options.
Hmm.
But if you want to stay in the location, you probably also would like to have a competitive next lease that you sign, right? And there's no way to get the landlord to be competitive unless you have other options in the market. So that involves going to market, finding other options, negotiating out those options, and then going to the landlord and saying, hey, I know that my lease is coming up for expiration. I've been to market and I have some pretty enticing options to move, but I'd like to talk to you about what it might look like for me to sign another 5, 7, 10 years here. Here is what I would like that to look like. So that gives them a lot more leverage. Another big mistake we see is people kind of approaching their commercial real estate transaction like they would a residential transaction. So, what do I mean by that?
Hmm.
A lot of times when people go and they go house hunting, they look at all these different homes, right? And then they find the one, right? And so they're like, this is the one I want. And they go hard after that location. That works great in residential for the
Yeah.
most part. In commercial, that's a death sentence. So people need to be negotiating on multiple properties at one time. And there's a couple of reasons for this. The first one is deals die in commercial real estate all the time. They may die at the start line or they may die, at the finish line right before you sign a lease. So you don't really want to start over at ground zero if that happens. The second reason you want to do that is because you want to be honestly be able to tell the different landlords that they're competing for your business. If they think that you have fallen in love with their space and you have to have that space, then they're going to smell that. They're going to sniff that out, right?
That's
And
right.
you're not going to get their best deal. And then really the last reason is for peace of mind for the tenant. If you've not looked at other options, you don't really know what the market will bear. So at the end of the day, you sign a lease and you don't really know if you got a great deal or a terrible deal because you have nothing to compare it to. So
Right.
those are some of the most common things I see.
And I feel like your second point and your third point, they go hand in hand with your first point about giving yourself enough time to make sure you get the best utilization of your leverage, right?
Right.
Because oftentimes I get surprised by the clients coming in and saying, "Oh, I just renewed my lease," and they just did it themselves,
Yeah.
and without talking about any inclusion of TI allowance or looking at the market about what's competitive to make sure that the rent increase is in their favor or is competitive, and they just move forward. And I like the fact that you and your company, you guys actually keep track of it and get in touch with them about a year or a year and a half before it expires, because really in reality I think you should be doing this at least a year before it expires, not just a couple of
Yeah,
months
because there's
before.
so many different things you may run into. Like, what if you find a really great option to do ground up construction,
Hmm.
right?
Yeah.
You need a lot of time to do that. You can't make that happen in 6 months. So yeah, giving yourself enough time. If you're not tracking those dates or if you don't have somebody tracking them for you, the landlord is going to sit quietly by until, you don't have time to do
Right.
anything and then bring you the lease. And unfortunately, a lot of people have this misconception that signing, a lease on a commercial space is kind of like signing a lease in an apartment, right? Like you just go, they give you the paperwork and you sign it. And that couldn't be farther from the truth. You need to be negotiating on lots of different parts of that.
Right. Absolutely. Absolutely. And also, the possibility of what you just mentioned. That what if you have other options? Maybe you've been in business for 10 years and now your bottom line is healthy enough where you may want to consider a build out.
Right.
Right. And that takes
Right.
time, right? You can't
Right.
have a practice be built out in a month or two.
Nope. Not even really 5 or 6 months, So
Right.
so yeah, timing is so critical. And those are all things that if you're working with an agent, they can really give you some good guidelines on, the different types of transactions, how long you should plan, for each one. So if somebody knows, say they're 3 years out from their lease expiration, they're like, I really would like to consider ground up when it's time. Well, then I need to come see you about 2.5 years from your lease being up, for renewal, because it could take that long to find the land, to, figure out what we want done, to get the financing in place, all of that. So yeah, the timing is very critical.
Right. And also the other thing that I can think of would be the location factor, right?
Yeah.
Sometimes I see clients like going with a location if they're planning on moving, right? For dentists, it's not as common because, you have all the heavy equipment to
Yeah.
consider. Usually I see that whenever they're thinking of a build out, right? They're always looking at a city where they're currently living. And maybe that
Yeah.
place is already saturated and might not be the best place to open up another practice. And that's where I feel like, even professionals like yourself, you guys can have your input by saying, there are some great deals in these other parts. It's growing. We know the numbers. We see our other clients. I think you may want to consider other places.
Yeah, absolutely. That, as well as we have vendor partners that we work with
Hmm.
that can run reports and tell them areas that are, really hot for a new practitioner. And another thing to keep in mind is a lot of times, because we do so much dental and so much healthcare, our agents typically are going to be the first to know if there's a vacant dental spot available, which is kind of like finding a diamond, right? If you're
Right.
looking for a dental office and you can find one that's already built out, that's a big win.
That is a big win. Absolutely. Yeah. And that's also another thing. It's almost like insider trading, right? Having
Right. But
access to,
legal, but
but
the legal
illegal,
version.
but the legal version where you have access to information like that by working with the professionals. So not only are you getting the advantage of negotiation or someone who's exclusively working for you for your benefit, but at the same time you also get some input on what would be the best place to continue your business or start your business.
Yeah. And the one thing that we haven't mentioned yet, which is probably the most important piece for your listeners, is none of this costs them anything. So, real estate agents in commercial real estate get paid just like residential agents get paid. Landlords and sellers set aside somewhere typically between 6 and 8% of the commission for their agent to split with a tenant's agent. So if the tenant, the dentist, the orthodontist, whoever it is, comes unrepresented, not only do they get a less fair deal, the landlord's agent just gets that full commission. Versus if they bring somebody to the table that's an expert in representing them and negotiating for them, um, they're not having to pay for that. The landlord still pays for that. It comes out of that fee that they've set aside for their agent. So they stand to save, tens to hundreds of thousands of dollars over the life of their lease, and it doesn't cost them anything.
Amazing.
Yeah,
Yeah.
kind of no downside, right?
Right. It's like a win-win situation. It's like, why wouldn't I use one?
Yeah.
Especially,
That's really our biggest competition, is really people not knowing we exist. People
mm,
just not realizing that the service is there and that they should be using someone.
oh, absolutely. It's one of those things that when we get clients that have these questions, we always recommend utilizing a professional to help them with the transition.
Yeah.
It just makes sense and it doesn't cost them anything. So why would we have an issue with it?
Yeah.
Now, you mentioned vendor partners, but if I understand correctly, you guys let's say if somebody's looking for a build out, right? You guys also have networks within the lending world, right? Where you can
Oh,
recommend,
yeah.
you know,
Yes, we absolutely do. We have some fantastic relationships, not only with some of the big banks that, you would know if I said their
mhm,
names, they're
mhm,
all over the place,
mhm,
as well as local community banks as well. And our team is very good at identifying, okay, what does this client need? What do their financials look like? Who should I make introductions to? And typically they'll introduce two or three different lenders for the client to interview and to talk to. But in addition to lenders, we also have, financial planners. We have CPAs that we work with. We have general contractors. So if you're leasing a space that needs a full build out, you want to make sure that you use somebody that understands healthcare build out, just kind
mhm,
of like you wouldn't use a residential home builder to build out a medical office, right?
mhm.
So just having the right team in place is critical. And that's part of our focus in healthcare is knowing who all those players are and knowing when to bring them into a deal and introduce them to our clients.
That's amazing. It's almost like a one-stop shop.
We try, we try.
Right, that's good. And I know, and I can vouch for that because I remember this one time I went to a networking event where I met someone from Carr, and I think I had a question about a client who was looking for a signage guy. He immediately connected me with somebody that he usually works with in the Dallas Fort Worth area, and I was just blown away. And he picked up the phone. And he was like, "Oh yeah, sure, yeah, I can make some time for your
Yeah.
client." And
Yeah. And really, that's what a good agent should do. I mean, they're supposed to be able to help hold your hand and be a resource for you from A to Z. Whether this is your first transaction or your fifth or sixth transaction, it's
mhm,
still important to have somebody that does this day in and day out, does it for a living to help make sure that you don't have any missteps.
absolutely, I agree. I agree. Yeah. Now, back to location, I guess.
Yeah. Yeah.
Now, I forgot to actually ask you. So, where are you located?
Me personally, I'm in Birmingham, Alabama.
I see.
Our headquarters is in Denver, Colorado, though, and then we have agents all over the country.
That is true. Yes. So, let's say if a listener or a client of ours is interested in working with Carr, would they contact you or would they go on a website and find the representative in Dallas? How would that work?
Yeah, I think probably the best thing to do is to go to our website, and there's
Mhm.
a contact us tab there,
Okay.
and that goes to a central location. And then they would disperse it to the right agent. Now, they actually can go online and they can filter through state, and then each state you can see who all the agents are and what markets they're in. And
Mhm.
then if they want to go and read their bios and stuff and choose somebody, you can actually contact our agents through the website as well. But probably the easiest thing to do is just to send an inquiry through our website, and that will get routed to the right person.
Fantastic. That's amazing. Now, would it be possible for them to reach out to you guys, let's say, well before the lease is going to expire, but they just want to make sure somebody's going to send them a reminder?
Yeah, absolutely. In fact, one of the services that we provide is lease abstracting. And so,
Mm,
what that means is if they'll give us a copy of their lease, we're
mhm,
going to do two things with it. The first thing we're going to do is we're going to take out all the pertinent business information and put it into a summary for them that's very simple, easy to read.
mhm.
If you've ever looked at a commercial lease, on a good day, they're 20 to 30 pages, and on a
That's good.
bad day, they're like upwards of 70.
Mhm.
And so that can be super cumbersome if you have an issue at an office and you're like, hey, the air conditioning is out. What did we negotiate on maintenance? Who are we supposed to call? So it will outline all of those details for you in a very concise format. So most of our clients, they give that to the office manager. They set that aside for if they need it. The other thing we're going to do is we're going to look at your dates. So when does your lease expire? When is your renewal notification period? So that's a period of time before your lease ends where you need to let the landlord know if you plan to vacate or renew. So we're going to track those dates. We're going to put them in our system so that our system will alert us in turn to alert you and say, hey, Dr. Jones, guess what? I got the alert for you. Your lease is coming up, 18 months, 2 years, whatever we decide on. Let's sit down and have a conversation about, what your plans are. So yes, we can absolutely do that for them.
Oh, that's amazing. Okay, so that's actually quite a bit of help. And what kind of commitment would the client have to make?
There really is no commitment there, just, I guess, to have a conversation with us when the time comes to evaluate whether or not they want to use our services moving forward. I failed to mention another thing. When we do the abstract, we're also kind of doing an evaluation. So our agents will look at that lease and say, okay, here are some things that I see in here that I think we could or should improve the next time around. And these are things that I would like to see changed. So they'll kind of have an idea of, I guess the red flags that the agent sees that they would like to address in their next term.
Oh, fantastic. Oh, that's amazing. Yeah. Okay, that's good. I'm getting ideas here.
One of the things we haven't mentioned that I would like to say really quick is, so our agents that work all across the country, they're working with, the single dentist, the single, pediatrician, different healthcare professionals. We also have a team, and these are the folks that I oversee that work with national accounts. So these are the DSOs, the groups that are either across a state, across a region, or across the country. We also have the ability to help those guys and really streamline their processes. Typically, the way that works is they're assigned an account manager from within Carr that really gets to know their organization, what they need and want from a real estate perspective. And then wherever they have a transaction, whether it's a renewal in one city, a de novo in another, and maybe, an acquisition in a third, that Carr account manager will pull in the local agent in each of those markets to help them with that transaction. So they get the local expertise, the local knowledge, but yet they have that primary point of contact at Carr that can simplify communication and process.
Okay, wow, that's amazing. Okay, so not just the single practice owners, but also the DSO folks.
That's right.
Okay,
Yep.
That's amazing. And again, I can vouch for Carr because, as I mentioned before, at a networking event, I actually met someone who's with Carr now, who's been with them for over 2 years, and he used to be a former dentist himself.
Yeah. You'd be surprised. We have former dentists, we have former pediatricians, we have a pharmacist. Yeah, you'd be surprised how many healthcare professionals we actually have on the team.
Right. So when they say they really know this industry, like I said, I can vouch for them. They do.
Yeah, they really do.
Okay, that's amazing. Well, thank you so much for being on our episode today, Paige. It was wonderful, and I'm sure our listeners have learned some valuable information. And let's not forget, again, if you're on the buying end, it's not going to cost you a penny to work with them. You guys don't have to pay them. The seller will, right? So keep that in mind. And if they do need to contact you, would you mind dropping in your contact information?
Yeah, absolutely. I can do that.
Awesome. So would it be an email or a phone number?
I guess what is easy? Do you want me to just
say
give
it
it
out
to
loud?
you now, or did you want to?
Okay, pause. Up to you.
Yeah.
We can also add them in the show notes if you want. So do you want
Whatever
me to
you
leave
want to do is fine with me. I just wasn't sure what you were wanting. Wanting my response to be right there.
Oh, I see. I apologize. I know you had
okay.
already mentioned like to go on the website and find people, but then at the same time,
I can give you my email. That's easy.
Do you want me to direct them to you personally, or just Carr generally? Okay.
You can. Yeah, either one.
Either way's fine.
Yep. Yeah. So my personal email, if they want to reach out to me, is Jennifer JENNIFER .page PAGE, like a page in a book, at Carr CARR.US, like United States.
Perfect. Amazing. All right. Well, thank you so much again for being in our episode. It was a pleasure. Thanks for listening today. Be sure to subscribe to Beyond Bitewings on your favorite podcast platform. For more information, you can follow us on Facebook, Twitter, and LinkedIn, or reach out to us on our website, can also shoot us an email at info@eandassociates.com.